I want to introduce you to an herbal chemical sideline treatment and overall breathing strategy to potentially reduce the mortality rate for COVID-19 patients. In February 2020, a Chinese study pitted herb-derived compounds against the novel SARS-CoV-2 coronavirus. At the top of the list is Betulinic acid. I've learned a lot about it and have taken a lot of it internally in the last 2 months, along with many other plant-derived compounds. There's a chance that I survived COVID-19 by self-isolating and using the treatment described. Right now, I'm showing little to no symptoms, even though I passed through what I think is the most severe set of symptoms 3 weeks ago. I'm about to be tested to confirm I have the antibodies for certain. A little background: I've been traveling abroad and researching independently for the last 8 years, studying humanitarian challenges. While living off the coast of Africa, in the Canary Islands, I became aware of the very deadly Ebola threat that was on the rise in Central Africa. I started scanning medical abstracts for alternative therapies that the Congolese or Ugandans would accept, since some Congolese were destroying the medical camps being set up by doctors, and they were killing the doctors themselves. I found an abstract that shocked me, which stated that chemicals derived from common turmeric were found to inhibit Ebola. Also, very importantly, the root herb Stephania tetrandra yields a chemical called tetrandrine, which also thwarts Ebola in lab studies. So I designed infographic campaigns for these herbs, which I sent to my contacts in Africa. Many, especially my contacts in South Uganda, were thoroughly grateful for this information. I then advised them on planting and harvesting turmeric for the future. Early this year, in late January, I started researching herb-derived chemicals that could combat SARS-CoV-2. I published blog articles of my findings in English and made a push to have them shared in China as well. I decided to return to the USA ahead of the wave of infections I expected to see here. After only 1 week stateside, I began showing symptoms. So I immediately began applying everything I had learned towards myself into a specific regimen that included digestion and deep breathing of Betulin-rich herbs. Moreover, zinc, vitamin C, Resveratrol, and other rich antioxidants also played important roles in my fight against COVID-19. My proposal is to design an herb-derived chemical vitamin supplement treatment, which could be placed into a capsule to reduce the viral count in the body, manage inflammation, reduce symptom severity, reduce period of contagiousness, and give the most at-risk patients an edge towards survival. It would need to show itself as especially effective for the pneumonia-related symptoms and lung and breathing problems. I've been sharing my findings publicly and advising others online via social networks. Reactions have moved from early skepticism to curiosity to belief as infected and suffering people apply this information to their own cases. I have a complete formula in mind, or versions of the formula, and an idea on how the testing can be done via laboratory. And then hopefully we can push for human trials in the very near future. The treatment formula would be relatively inexpensive and possible to mass duplicate or scale up for mass distribution. It would also have minor side effects. Dizziness from low blood pressure is my only complaint. NHS doctors in the UK have been recommending a specific deep breathing technique which coincides closely with my self-treatment technique, which is based on the Wim Hof technique. Thank you, Wim Hof. The only addition I recommend would be Betulin or Betulinic acid-rich oils to a cloth mask or breathing apparatus so that it can be taken deep into the lungs. I used a scarf and surgical masks and did deep breathing of these herbs, which were quite strong to me. The compounds in my suggested treatments for the stomach and lungs separately have been proven as safe with few side effects. So for the internal treatment, one possible testing formula, chemical mixture, and their herbal sources. I suggest to be taken by mouth twice a day with the milligram amounts to be determined, with adjusted amounts based on patient's response. Okay, I have to tell you I'm not a doctor, but this treatment works. and so we'd like to share it with every doctor that we can. I'm going to give you the natural substance and the chemical that's derived from it. We start with Chaga, which gives us betulin and betulinic acid. Then we move to Turmeric, which gives us Curcuminoids and Curcumin. Then Ganoderma Lucidum, which gives us Triterpenoids and Polysaccharides. Cloves, which gives us Eugenol. Rosemary, which gives us Diterpenes. Gingerol. Cinnamon, a very important chemical, is cinnamaldehyde. Black pepper with piperine. Grapes and berries give us resveratrol. Oranges give us vitamin C. Shitake mushroom gives us vitamin D. Kale gives us zinc. Rosehips gives us betulinic acid. And finally, garlic gives us important phytochemicals. Because it's being proven that COVID-19 damages the central part of the brain, the lungs, the heart, and the liver, it would be logical to administer a vitamin treatment that is neuroprotective, heart protective, pulmonary lung protective, and liver protective. Ganoderma lucidum extracts alone have been proven to aid all of these areas. Compounds in cinnamon are heart and artery protective. Turmeric is now widely studied. It is a body-wide anti-inflammatory, detoxifying, liver protective, cognitive enhancing, mood supporting, and investigated for neurological effect against diseases such as Alzheimer's. The brain aspects of COVID-19 are frightening, and anything that can reduce the confusion symptom alone would be welcome. So for the external, one possible treatment for the lungs would be administered once or twice a day, with the chemical concentration for inhalation to be determined, with adjusted amounts based on patient response. And we have tea tree oil with its terpene hydrocarbons, plus cloves with its eugenol, plus rosemary with its diterpenes. Tea tree oil is known already in managing and treating pneumonia. Betulinic acid and its sister chemical betulin have been found effective against cancer and HIV, and interest started to pit it against SARS-type coronaviruses as early as 2007, and that's why they're following up with it now. So finally, ellagic acid and tetraandrine should also be investigated against SARS-CoV-2. I don't have any direct experience with these, but both were shown to slow Ebola virus. Also, lignans should be investigated, as they also show potential for SARS-CoV-2. Green tea extract is also known to counteract influenza and should be considered last but not least. In summary, because of the production and distribution of SARS-CoV-2 vaccines, that's only one path to healing and one approach, and potentially not available for quite some time. So this other path for treatment should also be studied. An herb-based, science-based approach may contribute to saving lives in the near future. There's no harm in supporting the immune system of patients, reducing their inflammation, and delivering chemicals that have been trusted in traditional or classical historical medical work, from everywhere from China to Europe to the Americas, to the Middle East, to South Americas, to Russia, with many of these herbal constituents proven over time, even before the days of modern medicine. A mainstream consensus I agree with is that things are moving towards natural or preventative medicine, healthy diets, and taking herbs seriously. If that's not mainstream, I have heard it a lot. I was introduced to herbal medicine with reishi, which is also known as Ganoderma lucidum, in 2009, and I have consistently taken it year after year. It's helped me maintain a healthy immune system until today, in my opinion. I have a lot of respect for tea, herbs, and spices. It would be an amazing honor to bring these herbal chemicals to the spotlight for this COVID-19 crisis. Thanks for considering this treatment. Please share this with doctors around the world and help us bring this to light, this treatment, and share it also with your family and friends. Thank you.